Hi, my name is Nate Miller. I'm a student physical therapist at Campbell University, and today we're going to be talking about the technique of distraction and mobilizations into flexion and extension at the humeroradial joint. A joint mobilization is a manual therapy technique, which is basically we're going to use passive movements at the joint in order to restore optimal motion, function, and or reduce the pain in the patient. And today we're going to be demonstrating a grade 3 mobilization, which is a large amplitude rhythmic oscillation, and we're going to be moving into the restriction in the range of motion, so we're going to go just past the tissue resistance for this mobilization. So the humeroradial joint, as you can see on this skeleton, consists of the convex capitulum of the humerus articulating with the concave radial head, the fovea here, an anterior glide of the head, so moving this direction, is going to work on increasing elbow flexion, and then a posterior glide is going to work on elbow extension. So the loose pack position for this joint is full extension and full supination, which the skeleton is already in. And the most common dysfunction at this joint is a posterior radial head that is limited in anterior glide. So the stabilizing hand is coming towards the medial side of the patient and grasping the distal humerus, stabilizing there. The treatment hand is focused on the radius, so you want to get as close to the joint line as possible, but the palm of the hand is going to be on the anterior aspect of the radius, and the fingers are going to wrap around to the posterior aspect of the radius, and then you mobilize using those hand positions. So I have my patient here, Richie. And for the patient position for this technique, you want the patient in supine with the affected arm in full extension and full supination so we can work on it. So I'm just going to explain to Richie. We've been working with Richie for a while, so we got into our mobilization slowly. So we've already been through grade 1 and grade 2, made sure he's okay with that. And his main restriction now is movement. So Richie, we're going to do a joint mobilization to your elbow today. I've just noticed some restrictions in the movement, so we're going to be working on distraction and then working on getting you back elbow flexion and extension. So it shouldn't be uncomfortable at all, so let me know if you have pain.
Sure.
So the stabilizing hand is going to wrap around the distal humerus, the treatment hand, the palm on the anterior aspect of the radius, the fingers wrapping around the back to the posterior aspect of the radius. And first we're just going to apply a gentle traction. So we're applying a gentle longitudinal force going this way down the arm. And here we have our traction. Any pain with that?
No.
Good. So it's important to remember that with each of these mobilizations, we want to apply a traction force first during the movement. So we're going to start with a posterior glide, and this is to increase elbow extension. So you want to make sure you apply a small amount of traction, getting close to the joint line, and then we're going to be mobilizing directly down into the table. So for a joint 3, I go down. I'm using those large amplitude oscillations. Any pain with that, Richie?
No.
Good. And then for an anterior glide, the fingers are what are doing the mobilization, so the fingers are going to be pulling the radius upwards towards the therapist. So we apply our traction, and then the fingers mobilize the radius upwards.